Liver disease is one of the deadliest conditions, and it often shows no clear symptoms until it's too late. But your body might already be warning you in subtle ways: constant fatigue, itchy skin, strange reactions to food or medication. These aren't just random, they could be signs your liver is silently failing. Ignoring them could lead to irreversible damage. In this video, we'll uncover 12 shocking symptoms that most people, and even doctors, often overlook. Don't wait for a diagnosis that comes too late. Learn what to watch for, take action early, and protect your liver before permanent damage sets in. Sign number 1, persistent itchy skin, pruritus. If you've ever dealt with an itch that just won't quit, one that feels deep beneath the skin and doesn't improve with moisturizers or allergy medicine, it may be more than dry weather or a skin condition. This kind of relentless itching, known as pruritus, can be one of the first signs of liver distress. Your liver helps process and eliminate waste products, including bile salts. When the liver isn't functioning properly, due to conditions like cholestasis, primary biliary cholangitis, or hepatitis, it may not be able to move bile through the bile duct sufficiently. This causes bile salts to accumulate in the bloodstream. As these irritants build up, they can lodge in the skin, triggering a maddening itch. What makes liver-related itchiness unique is that it often has no visible rash, at least initially. It's frequently felt on the palms of the hands and soles of the feet, though it can also spread to other areas. The itching may be worse at night, affecting sleep and quality of life. People often attribute it to allergies, detergents, or age, and may spend months treating the skin while missing the liver issue altogether. Over time, the scratching may lead to open wounds, infections, or thickened skin from chronic irritation. If you're dealing with unexplained, persistent itching that isn't helped by skin treatments, and especially if you have other symptoms like fatigue, dark urine, or pale stools, ask your doctor for a liver function test. This simple blood test can detect early signs of liver stress. Remember, your skin is a mirror of what's happening inside. Don't ignore itches that won't go away. They may be your liver's first cry for help. Sign number 2, skin changes, spider angiomas and red palms, palmar erythema. Have you noticed odd red spots on your skin that look like tiny spiders, or the palms of your hands becoming red and warm for no clear reason? These changes might seem harmless, but they can be early signs of hormonal imbalance caused by liver dysfunction. Spider angiomas are clusters of dilated capillaries that appear just beneath the surface of the skin. They have a red center and thin extensions that resemble spider legs. While it's normal to have one or two, having several, especially on your face, neck, chest, or arms, can be a red flag for chronic liver disease, particularly cirrhosis. Palmar erythema is the name for symmetrical redness in the palms, often concentrated at the base of the thumb and the little finger. The affected areas may feel warm but usually aren't painful. These symptoms are often caused by an excessive estrogen in the bloodstream, a result of the liver's reduced ability to metabolize hormones effectively. When your liver struggles to clear hormones and toxins, your body often gives you visible clues. Unfortunately, many people mistake these signs for sun damage, allergies, or just aging. If you have multiple spider angiomas or persistent red palms and haven't recently started new medications or experienced sun exposure, it's wise to investigate further. Liver function tests and imaging like an ultrasound can help determine if your liver is struggling. These small changes might be your skin's way of pointing to a much bigger issue. Pay attention, they're visible signals from deep within your body. Sign number 3, unusual reactions to medications. Have you ever noticed that medications you once tolerated well now cause strong or unexpected side effects? This could be more than just aging, it could be your liver waving a red flag. The liver plays a vital role in processing and metabolizing drugs. Once a medication enters your body, It's your liver's job to break it down into forms your body can use or eliminate safely. But when liver function is compromised, whether from fatty liver disease, hepatitis, or cirrhosis, this detoxification process slows down or becomes erratic. As a result, drugs can linger longer in your system, reach higher concentrations than intended, or be metabolized into forms that are more toxic. This could lead to exaggerated side effects, prolonged reactions, or even toxic buildup. For instance, a standard dose of acetaminophen, paracetamol, may become harmful. Common reactions include excessive drowsiness, confusion, digestive upset, or headaches after taking routine medications. Some people may even experience allergic-like responses, not because of the drug itself, but due to how the liver is handling, or failing to handle, the chemical compounds. This sensitivity doesn't just apply to prescription medications. Over-the-counter painkillers, herbal supplements, and even certain vitamins, like high doses of vitamin A or niacin, can become risky when your liver's processing power is reduced. And since liver damage is often silent, many don't connect the dots until a serious reaction occurs. If you've started reacting differently to medications or need lower doses than usual, it's time to speak with your healthcare provider. A liver function test can help determine if your liver is the cause. Don't ignore your body's changing response to medications. This could be a critical early warning of liver distress. Sign number 4, heightened sensitivity to chemicals. Have you suddenly become more sensitive to everyday smells or chemicals, like cleaning products, perfumes, air fresheners, or even gasoline fumes? Do these scents now make you dizzy, nauseous, or give you headaches when they never used to? This heightened sensitivity could be your liver waving a distress signal. The liver acts as the body's natural filter, constantly neutralizing and eliminating environmental toxins that we inhale, ingest, or absorb through the skin. When the liver is functioning well, it helps keep your internal environment clean and balanced. But when liver function declines, toxins begin to accumulate in the body because they aren't being processed and removed efficiently. These lingering chemicals can then trigger exaggerated reactions in sensitive individuals. This isn't just about irritation or a dislike of smells. This is your body's defense system overreacting due to a toxic load. People with impaired liver function often report that strong odors now cause headaches, nausea, fatigue, brain fog, or even skin rashes. In some cases, they may become sensitive to things like scented laundry detergents, fabric softeners, or the smell of fried foods. This condition is sometimes associated with what's known as multiple chemical sensitivity, MCS, a controversial but increasingly recognized syndrome in which low-level exposure to common chemicals causes significant symptoms. While not all MCS cases are linked to liver issues, poor liver detoxification can absolutely make chemical intolerance worse. What's important to understand is that this symptom often appears gradually and may be brushed off as allergies, stress, or just getting older. But if your reactions to everyday chemicals have changed dramatically, your liver's ability to detoxify may be impaired. To support your liver, it's crucial to reduce chemical exposure wherever possible, choose fragrance-free or natural cleaning products, stay hydrated, and eat liver-supportive foods like cruciferous vegetables and garlic. And most importantly, consult a healthcare provider to check liver enzyme levels if this symptom sounds familiar. Sign number 5, sleep disturbances and mental confusion, hepatic encephalopathy. Do you find yourself struggling with insomnia, waking frequently during the night, or feeling unusually drowsy during the day? Have your loved ones noticed mood swings, forgetfulness, or moments of confusion? These may not simply be signs of aging or stress. They can be subtle symptoms of a liver condition known as hepatic encephalopathy. Hepatic encephalopathy occurs when a damaged liver can no longer properly filter toxins from your bloodstream, particularly ammonia, a byproduct of protein digestion. As these toxins build up, they can cross the blood-brain barrier and begin to affect your central nervous system, leading to changes in your cognitive function and sleep patterns. The early signs are often so subtle they're mistaken for burnout, anxiety, or even early dementia. People may experience mental fog, difficulty concentrating, slower response times, and short-term memory lapses. Sleep disruption is common, with many individuals flipping their sleep-wake cycles, feeling wired at night and sleepy during the day. Over time, if the condition progresses, it can lead to more serious symptoms such as disorientation, hand tremors, personality changes, and even coma in extreme cases. What makes hepatic encephalopathy particularly dangerous is how easily it can be overlooked or misattributed. Because the symptoms develop gradually, many people, and even doctors, don't immediately connect them to liver function. But these brain-related issues are often reversible if caught early and treated appropriately. If you're experiencing a combination of sleep disturbances, cognitive difficulties, or unexplained mood changes, don't write them off. Ask your doctor to check your liver function through blood tests like ALT, AST, and ammonia levels. The sooner hepatic encephalopathy is identified, the better the chances of recovery through dietary changes, medication, and improved liver health. Your brain and liver are intimately connected. When one suffers, the other follows. Don't ignore the quiet signs your body may be sending. Sign number 6, easy bruising and bleeding. Have you noticed more bruises appearing on your body, even when you can't recall bumping into anything? Do small cuts bleed more than they should, or take longer to stop? These may seem minor or age-related, but they can actually be warning signs of a liver that's no longer functioning as it should. Your liver plays a crucial role in producing proteins responsible for blood clotting. When it becomes damaged or overburdened, due to conditions like hepatitis, cirrhosis, or non-alcoholic fatty liver disease, it may no longer produce enough of these clotting factors. The result? Increased bleeding and easier bruising, even from light pressure or minor bumps. You may first notice frequent nosebleeds, bleeding gums when brushing your teeth, or more significant blood loss during menstruation. In some cases, small wounds may use blood for longer periods than usual, or you might find yourself needing bandages more often. Bruises may appear larger, darker, and linger longer than they once did. Some individuals also notice petechiae, tiny red or purple spots caused by minor bleeding under the skin. What's especially troubling is that these symptoms are often chalked up to being just part of getting older or attributed to medications like aspirin or blood thinners. While those can play a role, they may also be masking the deeper problem of poor liver function. If you notice increased bruising or bleeding and have not changed your medications, or if this is new for you, it's essential to get your liver enzymes and clotting function checked through blood tests like PT/INR. Early intervention can help slow or reverse liver damage and prevent complications like internal bleeding. Your body is constantly giving you clues. Easy bruising isn't something to brush off, it's a signal from your liver that something deeper might be wrong. Sign number 7, persistent low-grade fever. Have you been experiencing a mild fever that lingers for days or even weeks, without any clear cause? If you feel just slightly warmer than usual, consistently fatigued, and a bit off, you might be dealing with more than just a seasonal virus. A persistent low-grade fever could be a subtle yet important sign of liver inflammation or infection. The liver is not only a metabolic powerhouse but also plays a crucial role in regulating your immune system. When it becomes inflamed, due to hepatitis, fatty liver disease, or other chronic conditions, it can trigger an immune response that includes a sustained elevation in body temperature. Unlike a high fever from the flu, this type of fever is usually mild, around 99 degrees Fahrenheit to 100.4 degrees Fahrenheit or 37.2 degrees Celsius to 38 degrees Celsius, and easy to overlook. You might feel flushed, slightly sweaty, or just unusually warm at times. It may be accompanied by general malaise, brain fog, or muscle aches. Some individuals experience chills or a restless feeling, especially in the evenings. Because it often lacks dramatic symptoms, this kind of fever is frequently ignored or attributed to stress, overwork, or a lack of sleep. However, when the liver is inflamed, it signals the immune system to respond, resulting in this chronic low-grade fever. In some cases, the cause could be an underlying infection, like viral hepatitis, or even a liver abscess. In others, it's a direct consequence of fat buildup in the liver, non-alcoholic steatohepatitis, which triggers a long-term inflammatory response. If you've had a persistent fever for more than a few days with no other signs of illness, especially when paired with fatigue or right upper abdominal discomfort, it's worth having your liver checked. A simple blood panel, including liver enzymes and inflammatory markers, can help identify whether your liver is the root cause. Your body raises its temperature when something's wrong. Don't ignore this quiet, chronic heat. It could be the earliest clue that your liver is under distress. Sign number 8, strange body odors or bad breath, Fator hepaticus. Have you or someone close to you noticed a persistent change in your breath or body odor, something musty, sweet, or slightly rotten that wasn't there before? This unusual scent, particularly when it appears on your breath despite good oral hygiene, could be a sign of a serious liver issue known as Fator hepaticus. Fator hepaticus is a distinct and often unpleasant odor caused by the liver's inability to filter out certain volatile compounds, particularly sulfur-containing substances like dimethyl sulfide. When these toxins build up in the bloodstream due to liver dysfunction, they are exhaled through the lungs and detected as an abnormal breath odor. Unlike halitosis caused by dental issues or poor digestion, Fator hepaticus has a specific smell described as sweet, fecal, or slightly metallic. This symptom is typically associated with advanced liver disease, especially cirrhosis. But in some individuals, it can appear earlier, particularly if there's chronic inflammation, fatty liver disease, or poor toxin clearance. The liver is your body's main detox organ. When it becomes impaired, waste products that should be broken down and excreted begin to circulate, leading not only to changes in breath but sometimes also in urine and general body scent. People with this issue might also report that certain foods, like garlic, onions, or meats, make the odor worse. Others notice stronger smelling sweat or changes in the way their clothes or bedding smell after a night's sleep. In rare cases, family or close friends may notice the odor before the person experiencing it does. If you or someone you know is dealing with persistent strange odors, especially when combined with fatigue, yellowing eyes, or digestive changes, it's important to get liver function tested. This seemingly embarrassing symptom could actually be an early clue to a deeper problem. Don't ignore what your body and breath may be trying to tell you. Sign number 9, sudden or worsening skin conditions. Have you been struggling with unexplained skin flare-ups, like eczema, psoriasis, or persistent adult acne, that seem to appear or worsen out of nowhere? Your skin might be trying to compensate for a liver that's no longer able to perform one of its key jobs, detoxification. The liver filters toxins, metabolic waste, and excess hormones from the blood. When it's overloaded or damaged, these harmful substances can build up and attempt to exit the body through alternative pathways, including the skin. This detox overload can trigger inflammation, clog pores, and weaken the skin's natural barrier, resulting in breakouts, rashes, dry patches, or red, scaly areas. Many people don't realize that chronic skin conditions may be linked to internal organ dysfunction, especially the liver. Several studies have found a strong connection between non-alcoholic fatty liver disease, NAFLD, and inflammatory skin disorders like psoriasis. In fact, some research shows that up to 50% of people with psoriasis may also have undiagnosed fatty liver disease. The signs can vary. You might notice persistent acne on the cheeks and jawline, new eczema or dermatitis outbreaks that don't respond well to topical creams, or worsening rosacea that flares with certain foods. The skin might also feel unusually oily in some areas and dry or flaky in others. These symptoms often reflect imbalances in toxins, inflammation, and hormone metabolism, all of which are governed by liver health. Treating these issues with creams and ointments might offer temporary relief, but if the root cause lies in liver dysfunction, the skin problems will keep returning. Supporting liver health through a clean, whole food diet, staying hydrated, avoiding alcohol, and reducing processed foods can significantly improve your skin over time. If your skin has suddenly become harder to manage or resistant to treatment, don't overlook the possibility of liver involvement. Your complexion often reflects the state of your internal health. Listen to what it's saying. Sign number 10, flushing and discoloration. Have you ever experienced sudden flushing of the face, chest, or neck, without any clear reason like embarrassment or heat? Or perhaps you've noticed your skin tone darkening, or unusual patches appearing on your body. These changes in skin color may be more than cosmetic, they could signal liver dysfunction beneath the surface. Flushing is the appearance of sudden redness or warmth, often rising from the chest to the face. It might resemble blushing but can occur spontaneously and persist longer than a typical flush. This is often linked to hormonal imbalances and changes in blood flow caused by a struggling liver. When the liver can't efficiently break down hormones such as estrogen, their levels rise, causing the dilation of blood vessels, resulting in episodes of visible flushing. In addition to flushing, some people notice hyperpigmentation, dark patches of skin that may develop around the eyes, mouth, armpits, or other folds. A dull, ashy, or yellowish tint to the skin can also emerge as bilirubin levels rise in the blood, especially in early stages before full-blown jaundice sets in. The skin may look muddy or unhealthy, even if you're taking care of yourself. Other changes include skin texture becoming unusually dry or greasy in certain areas, or visible redness that's mistaken for rosacea or allergic reactions. These signs often go unnoticed or are brushed off as aging, stress, or sun damage. Yet these are real signs of what's happening internally. Your liver is losing its ability to regulate circulation, hormones, and detoxification effectively. If you experience persistent or unexplained flushing, discoloration, or skin texture changes, speak to your doctor. A physical exam along with liver function tests can determine whether your liver might be contributing. Your skin is your largest organ, and sometimes, it's the loudest messenger for what's going wrong deeper inside. Sign number 11, digestive issues after fatty meals. Do you often feel bloated, gassy, or uncomfortable after eating fried or fatty foods? Do these meals leave you with nausea, indigestion, or even oily stools? While it's easy to blame a sensitive stomach or irritable bowel syndrome, these digestive issues could actually be linked to your liver's performance. Your liver produces bile, a critical fluid that helps break down fats in the small intestine. Bile is stored in the gallbladder and released when you eat fatty foods. But when the liver is sluggish, inflamed, or impaired, bile production and flow can be disrupted. As a result, fats aren't properly digested, which can lead to symptoms like bloating, excessive gas, diarrhea, constipation, or greasy stools that float. One telltale sign is feeling overly full or nauseous shortly after a rich meal. You might even notice a dull ache in your upper right abdomen, where the liver and gallbladder reside. These symptoms are often dismissed as poor diet choices, acid reflux, or age-related indigestion. However, they can also indicate issues like non-alcoholic fatty liver disease, NAFLD, or biliary sludge, which occurs when bile becomes thickened due to poor liver function. In more advanced cases, impaired fat digestion can also interfere with your body's ability to absorb fat-soluble vitamins like A, D, E, and K. Over time, this can lead to deficiencies that affect your immune system, skin, and bone health. If you've been experiencing recurring digestive discomfort, especially after fatty meals, it's worth looking deeper than just the stomach. A liver function test and abdominal ultrasound can help assess how well your liver and bile system are functioning. Supporting your liver with a healthy diet, limiting processed foods, maintaining a healthy weight, and staying active can make a big difference. Don't ignore what your digestion might be trying to tell you, because your liver plays a starring role behind the scenes. Sign number 12, rapid intoxication and severe hangovers. Has your tolerance for alcohol dropped dramatically over the past few months or years? Do you feel tipsy after just one drink or suffer from extreme hangovers after consuming what used to be a moderate amount? This isn't just part of getting older, it could be a sign your liver is no longer metabolizing alcohol efficiently. The liver is your body's primary site for alcohol breakdown. It converts alcohol into acetaldehyde, a toxic compound, and then into acetate, which is safely eliminated. When your liver is healthy, this process happens quickly and effectively. But when the liver is damaged, whether due to fatty liver disease, inflammation, or scarring, its ability to process alcohol slows down significantly. As a result, alcohol remains in your bloodstream longer, leading to a stronger and prolonged intoxicating effect. This phenomenon is sometimes called reverse tolerance, where even small amounts of alcohol have an outsized effect. You may feel lightheaded or drunk after just one drink, and symptoms like nausea, dizziness, or fatigue may linger far longer than they used to. Worse, hangovers can become more intense, lasting well into the next day with dehydration, headaches, and gastrointestinal discomfort. While many people laugh this off as not being able to party like you used to, it's actually a serious warning sign. A declining alcohol tolerance means your liver may be losing its detoxifying capabilities, a hallmark of progressing liver disease. If you've experienced a noticeable change in how your body reacts to alcohol, it's important not to ignore it. Speak with your doctor and request liver enzyme testing, particularly ALT, AST, and GGT levels. In some cases, lifestyle changes, early diagnosis, and abstaining from alcohol can help restore liver health and prevent long-term damage. Your liver may be silently suffering, and your next glass of wine might be revealing more than you think. If you recognized even one of these symptoms, don't shrug it off. Talk to your doctor and ask for a liver function test. It could be the difference between silent damage and a second chance. Like, share, and subscribe if you want more science-backed tips that protect your health after 50. And let us know in the comments, have you ever noticed these signs in yourself or a loved one?